For a lot of patients, cancer can come as a total surprise. What I start my first conversation with them is you don't have to remember anything about what we do today, except that I'll be a part of the team. And when it's time for you to come back to me, we'll get you through step by step through the radiation. I like talking to people, meeting people and easing their mind about something that's really hard. Even though it might be routine for me because I treat breast cancer every day, it's nice to be able to take a glimpse of what I do to ease their mind and get them through it. And that's what radiation oncology offers me. What's very exciting in radiation oncology is that, especially in breast cancer, we've moved forward with shortening treatment time. So for a long time, radiation would be up to 6 to 7 weeks of treatment. In modern day radiation, we can shrink that down to 3 to 4 weeks versus sometimes even down to 1 week. No one comes into radiation saying that they really want to get radiation treatment. But by the end, they're sometimes a little sad that they're leaving the department because they've built this relationship with the radiation oncologist, with our nursing staff, with the radiation therapists that do the daily treatment for them. And so it becomes a little bit of a family for them.
I feel very fortunate to be in this field. I almost exclusively work with women patients, helping them through screening and diagnostic and biopsies. It's really women supporting women with the best healthcare that we can provide. It's such a comfort to me as a physician, knowing that my patients, after they leave my office with a diagnosis, are in the best set of hands that they can be in this area. Every week, we get to participate in a tumor board discussion where, as radiologists, we bring all of the imaging that the patients have had, and we get to review those images with the team. We're quiet radiologists, but when we're in tumor board, our opinion really matters, and it helps patients a lot. If there's one thing I hope that everyone takes away from today is that annual mammograms are so important, and prioritize your health and make sure that you're not skipping your annual screenings.
One of the greatest things about, our job in particular is it doesn't just stop with surgery. We get to be involved with kind of managing their treatments, helping them through the side effects, and then participating afterwards in survivorship and being with them for years to come. This really gives you the ability to participate in the full scope of a patient's care. When we go into a surgical subspecialty, obviously all of us have some element of love for surgery, but there's something deeper than that for me. I think the fact that we can offer patients life-changing surgeries with 5 small incisions by using a robotic approach, which every time I explain this to a patient, they're in awe. I think it's unparalleled when historically we were making these big up and down incisions. They were staying for 5 days in the hospital. Post-operative complications were so high, post-operative pain. These things are all manageable now. I think it's one of the most exciting things about, operating in the field of GYN oncology is the ability to perform these procedures in a minimally invasive approach.
I love caring for my patients because being someone that can be there to support them and help them through it and answer a lot of the questions and uncertainties that they might have is a really good feeling to be able to give them kind of that support and that stability during their treatment. One of the really unique things about radiation oncology, unlike many other medical specialties, is that we actually meet with our patients one-on-one, face-to-face every week as they're going through treatment. So we really get to see them very frequently and really build a bond with them through those treatment visits. Our partnership with MD Anderson in Houston is great, I think, both for the doctors here at Cooper and also for our patients. I know that working with them, kind of bouncing ideas off of our colleagues in Houston, has made me a better doctor and become more expert in my own field. It's really exciting to work at a hospital that focuses on kind of pushing the leading edge, getting those new technologies, being involved in clinical trials so that we can offer the most to our patients. We can offer them very solid, standardized treatment, but we also have options when patients maybe have gone beyond what that standard treatment can offer them.
When I was a young woman, my mother was diagnosed with a cancer that was very aggressive. So I got to see a side of cancer as a family member. I felt I could really help people. So I saw the struggle. I saw the barriers. There's financial barriers. There's emotional and spiritual situations that these cancer patients have. It's wonderful that Pink and Teal supports the Patient in Need Fund. I think that our patients will be greatly helped by that. Our radiation oncology services here have been approved by MD Anderson in Houston, and we work alongside of Cooper Camden to have raised to that level to where we can offer patients in this community, state-of-the-art treatment.
I've been here for 36 years now, and I've become not only a provider in the community, but I'm a member of the community. A woman I took care of for breast cancer, she was in the ACME and grabs me and hugs me and thanks me for the care that she received here. It's a great experience. Historically, treatment of breast cancer has been kind of cookie cutter. Today, it's much more personal and targeted, depending on the genetics of the tumor, the genetics of the patient. I have to give credit to a wonderful woman who I took care of in the past. Her name was Jane Osborne. She thought enough of us to leave us $3 million to build this great women's center, and we're hoping to take it to the next level. With our new affiliation with MD Anderson at Cooper, everybody feels part of the team. This is a great thing for not just today, but 10 years in the future.
I'm honored to be recognized this year as a hero for Pink and Teal.
Pink and Teal does tremendous work for the community for breast cancer. So for us to represent our department as well as the Cancer Center feels like a tremendous honor.
I'm doing this, but I have everyone behind me in my team, so I'm thinking that it's sort of the team that's being honored.
I've been at Pink and Teal so many times and honored my fellow colleagues and radiologists, and it's so special to be chosen as a Pink and Teal honoree and for the work that I've done here at Cooper.
You never feel that you're worthy of an award, but I've been in the community for 36 years. I've touched a lot of lives over that period of time. I can't tell you how many patients I've operated on for breast cancer over that course of time. It's so inspiring, and I feel honored to be honored.
I feel so privileged. I'm so grateful for the honor to be, recognized and considered as, part of this journey is just, it's something that I will always cherish, and I'm incredibly grateful for that honor.